Hi, I'm Dr. Kenneth Fink. I'm a medical oncologist at Zimmer Cancer Center at New Hanover Regional Medical Center in Wilmington, North Carolina. Survival of lung cancer is a very difficult issue. Most folks, when they hear they have lung cancer, know that there could be quite a bit of problem with surviving that. It turns out that about 25% of patients diagnosed with lung cancer are potentially curable from the standpoint of having surgery. The other 75% will not be able to have their tumor removed surgically because it's already a bit too advanced or has spread into their lymph nodes. So for the 25% who come in with a localized tumor, what we call either stage 1 or even stage 2 cancer, meaning that the tumor is confined to the lung and may have spread perhaps into a localized lymph node but hasn't spread to a distant lymph node further away from the primary tumor, those patients can undergo surgery. What happens is a surgeon can come in, remove about half the lung, or what we call a lobe, can do a lobectomy, is the term we use, to remove that part of the lung that contains the tumor, and remove any small lymph nodes that may actually be held within that lobe. This can result in a cure in about half the patients that have that surgery. Unfortunately, the other half are going to have a recurrence. So even for the 25% that we find have a confined tumor, about half of those are going to have a recurrence. For the other 75% of patients who can't have surgery, unfortunately, most of them will undergo treatment, including very heavy treatment, perhaps with radiation and chemotherapy, and perhaps a tenth of them may have a long-term survival. So for the vast majority, about 70% of our cancer patients, unfortunately, they will be succumbing to that and will die of their disease. The survival rate has gone up, however. Although 70% may have lost their life to lung cancer by about 5 years, there are still, that number has improved considerably. People are living, even with metastatic lung cancer, for a year or two. We are at a point right now where about half of our metastatic lung cancer patients are alive 1 year after being told that their cancer has already spread to other parts of the body. And that's much better than in the years before, where only 10 or 20% may have been alive at the 1 year point. Overall, our survival rates have doubled in the last several decades. So although still a very difficult disease to have and a tough one, especially if your cancer is not surgically removable, the survival of lung cancer has improved considerably with many of the modern treatments that we now have to offer.